Okay, good day, fellow learners. Welcome back to my channel. This is your mentor, Ray, also your fact check buddy. And I'd like to congratulate you for tuning into our channel today because I'm going to talk about something that you need to know for your test. Okay, so before we get to start, I'd like to ask for your help for a mission I have started several months back. So I'd like to ask you to join me in this mission. Our goal is to provide free NCLEX RN application review to 100 nurses. Our numbers are growing and they've been pretty successful doing their NCLEX review through our channel. I'm so thankful and so glad and honored to be of service to everyone. I'm all yours, guys. I'm here for you. I'd like you to turn your great American dreams to reality. So wherever you want to practice your profession, I'm here, your mentor Ray, and your fact check buddy to help you out. So to help us achieve this, just watch and finish the ads in our videos. That's all I'm asking of you guys to keep this channel moving and to help our colleagues. Please don't skip the ads on our videos. Okay, so thank you so much for doing so. So if you have anything which you may want me to cover in my future videos, a lot of you are requesting for a lot of things. Okay, I'm doing it one at a time, guys. Don't worry, I'm going to cover all your requests. So send me your requests through this email, mentor.raygapuz@gmail.com. And here's the disclaimer. Now let's begin with pressure injury pointers. Now some of you may not be so focused about knowing certain things about the care of a client with pressure injury. This used to be known as your bed sore or pressure sore. It's known as pressure injury. Okay, they're one and the same, just different names. So here's a functional concept. Remember, a functional concept could be a word, a sentence, a phrase, or even a paragraph that helps you deconstruct questions on the actual test. Here we go. Let's begin with the first one. Pressure injury. Okay, injuries rather are injuries to the skin and underlying tissues. So as they say, the skin is the first line of the body's defense against infection. So a broken skin, therefore, increases the risk for the client to develop infection. So if you'll be asked, what is the priority nursing diagnosis for a client with pressure injuries, you could potentially answer risk for infection. Okay? And the risk doubles if you talk about the population who are either very young, below 1 year old, or very old, above 60. So in essence, if you have a patient who is an elderly, there's always a risk, especially if they're bedridden or if they're debilitated, okay, because of the shearing force, there's an increased risk for them to develop pressure injuries. Let's move on. So the highest priority in the prevention of pressure ulcer is frequent, regular change in position. Talk about changing the patient's position every 1 to 2 hours. And that should be done regularly because it's exposure to sustained pressure that increases the risk for the development of pressure injuries. So, who are the patients who are at risk to develop pressure injuries? These are your wheelchair-bound patients, remember wanted, the aging adult, the clients with neurological conditions like Alzheimer's disease, those who have been exposed for a long period of time to pressure, too long exposure to pressure, excretion problems, those who are bowel and bladder incontinent. Remember, they get skin maceration because of the exposure to the acids, okay, from the urine and the feces. And of course, those with diabetes or they have nutritional deficiency. Once again, the code wanted. Wheelchair-bound patient, the aging adult, clients with neurological conditions like Alzheimer's disease, those who have had too long exposure to pressure, those with excretion problems, including bowel or bladder problems like incontinence, and those with diabetes or deficient in nutrition. Okay, so take note, clients who are on a low protein diet would usually have decreased colloidosmotic pressure that causes the shifting of fluid into the peripheral, okay, system. So what happens now is that there's going to be edema, and an edematous area of the body is most at risk to pressure injury. So once the fluid shifts from intravascular to interstitial or extracellular or extravascular area, So that could be a danger for the development of pressure injury. So if you would want to find out the relationship between laboratory data and the development of pressure injury, pay particular attention to the amount of albumin, because a decreased albumin levels could mean decreased colloid osmotic pressure, and that leads to edema formation, which increases the risk for pressure injury. Okay, let's move on. So the elderly client is at risk to develop pressure injury due to shearing force. So if you'll be having a question that says, which of the following clients is most at risk to pressure injury development? So you could focus on anyone who is above 60 and who is bedridden. That's because of the shearing force. Okay, that's the force that is exerted on the skin, the presence of the linen, especially if the client is on a semi or high Fowler's position. Okay, so because of the shearing force as they slid down the bed, so there's a risk for the development of pressure injury. Okay, now there are four different stages. Okay, we have stage one, in which there's no open wound, you just have a reddened skin. In dark skinned clients, it will have a different color. So there's no blanching, the skin looks warmer. So this is just like sunburn. Okay. Now, for stage one patients, this is managed with frequent change in position. They are allowed to use pillow for support, use of mild soap and water, as well as the use of foam and moisturizer. Now, avoid shear or pressure. So once again, you have to make sure that the patient who is bedridden is not sliding down the bed, because that would increase the pressure due to the shearing force on the skin. Okay, so can you delegate the care of a patient with stage one pressure ulcer to the unlicensed assisted personnel? The answer is yes, you can. Okay, for stage two, you have an open wound, an ulcer that is painful and tender. Focus on this class. Blister with clear fluid. It's like, a second degree burn. So in this stage, there's also a crater. So which means there's already an injury to the skin. So this is usually cleaned with saline solution, and you have to avoid hydrogen peroxide at this point, because hydrogen peroxide may potentially, okay, cause debridement of the skin. So cover with special dressing gel or foam, and the petroleum jelly could be applied, as well as an antibiotic ointment. So you just have to keep it clean, and the dressing that's used would be your hydrocolloid dressing. So it just gives the appropriate amount of moisture necessary for wound healing to occur. This is a little bit of a challenge, especially if you have patients with diabetes. Okay, so stage three, this time the sore extends under the skin. So there's going to be fat exposure and tunneling occurs. When you say tunneling, okay, so the pus that could be underneath the skin is going to bore a hole into the adjoining or surrounding tissues, and that's when a tunnel is created. Okay, so when you have a stage 3 pressure ulcer, you have an opening, so avoid massaging the area. Of course, it needed to be debrided and then eventually dressed. Then you have to provide proper nutrition. That's going to be high protein diet to promote wound healing, and keep the patient hydrated to keep the skin moist, because a dry skin could be more at risk to infection. And then keep the head of the bed low, once again, to prevent shearing force. Stage 4 occurs when you have a deep injury that affects muscles and the bones. And this is usually treated with, once again, debridement and dressing. Okay, so what if in the item, when you're answering a question, you're shown a picture such as this? So it's different when you just memorize the characteristics than when you're given a picture. So don't forget this, class. For those who are taking the NCLEX, this one thing I bet you have to remember. So this picture tells us that this is a stage 3 pressure ulcer on the hip. Okay, and with this, you have to avoid massaging the area. Okay, so your priority nursing diagnosis could be impaired skin integrity. Now, this is a stage 4 when you already have exposure of the bone, and of course, affectation of the muscles. Okay, so this is very deep, and it needed to be treated properly. It has to be debrided and dressed properly, and eventually treated with potential skin grafting. Okay, so document with when a wound changes category. So you have to be descriptive. Describe how a stage 1 progressed to stage 2. Or you can also describe how a stage 2 eventually is healing. The key word when you're doing a documentation of pressure injury is that you have to describe the wound. Describe it. Don't just label it and say the wound is healing. That's not a good thing. That's not a good documentation. You have to use terminologies to describe how the edges of the wounds are approximating, how the wounds could be moist, describe the color, the characteristics. If there's a foul odor, do so. So having that functional concept in mind, let's use that to question on the test. So the nurse is assessing a client's pressure injury. Upon examination of the wound, the nurse notes that the bone, muscles, and cartilage are no longer exposed, as were previously noted. So if the bones and the muscles used to be exposed, so you're talking about previously this is a stage 4 pressure injury, and now a layer of fat is however visible. So you just have a layer of fat there that's being exposed. And then here's the question: which documentation entry best describes the correct way of documenting the improvement in the patient's pressure injury? The wound has improved from stage 4 to stage 3. Even if this is correct, this is not descriptive enough. So what might others consider as stage 4 may not be the same staging criteria that you have in mind. So it's very important that you have to be descriptive. How would you know that a stage 4 pressure ulcer has improved to stage 3? Okay, reddish skin surrounds the ulcer on the sacral area, which is approximately 1.5 centimeter in diameter. Previous exposure of bone, cartilage, or muscles no longer noted. This is very descriptive. Some fat cells are visible. Okay, 3. The pressure injury has gone from stage 4 to stage 3 in a week's time. Great progress in healing noted. Well, the word great is a matter of opinion. Okay. What might be great for you might not necessarily be great for others. So this is very subjective. It's not objective enough. So we can discard that option 4. Wound healing is taking place as predicted due to the great care of the nurse. Wow, we have a hero. A nurse who knows how to predict what's going to happen. And look, this documentation is not about the patient. It's about, praising the nurse. And this at this point in time, this is not about us, colleagues. This is supposed to be about the patient's recovery. So the best answer would be option 2. Reddish skin surrounds the ulcer on the sacral area, which is approximately 1.5 centimeter in diameter. Previous exposure of bone, cartilage, or muscles no longer noted. Some fat cells visible. Okay, so always remember the functional concept. Care of the patient with stage 1 pressure ulcer can be delegated to the unlicensed assistive personnel. Why is that so? You don't have an open wound for stage 1. You just have redness. So you have to make sure the client is turned regularly, so to prevent it from progressing any further. So here's another functional concept. Do not document other skin injury with other etiology other than pressure injury. So if you're being asked to monitor the progress of the injury of the client, specifically the pressure injury, just focus on assessing the pressure injury. Don't assess for the rashes that the patient could have due to an allergic reaction. Don't mention about the patient's scabs associated with chickenpox maybe, because you just have to focus on the pressure injury if you are supposed to documenting just the progress of the pressure injury. So let's summarize what we've learned. So you have stage 1, pressure injury, when there's non-blanching redded intact skin. So non-blanching means when you press on the skin, it doesn't turn into its original color. Okay, and then stage 2, partial thickness, loss of skin without slough, shallow open ulcer, but this time you have a blister with white or yellow eschar. So the blister is the keyword for stage 2, just like second-degree burns with a blister. Stage 3, you have a deep ulcer with white, yellow eschar. We say eschar, these are tissues with no blood supply, or simply dead tissues. Full thickness skin loss with slough, no bone, muscle, tendon exposure. So stage 3, you just have exposure of fats, maybe, but no bone, muscle, and tendon exposure. Once you have exposure of the bone, muscle, and tendon, then that's going to be stage 4, when you have black and brown eschar. Okay, then you have DTI. It's not the Department of Trade, guys. It's deep tissue injury. Okay, you have a maroon or purple intact skin. However, you have a blood-filled blister, and the danger is that when this pops out, you have a break in the skin, and the more that the patient will become at risk for infection. And then you have what we term as unstageable. So it's going to be like a mixture of characteristics of these previous stages, like there's gray, green, brown, black eschar. There's full tissue loss with base of the ulcer covered with slough. Okay, so what is important to note here is that there's a mixture of a stage 2, 3, and 4 in one. Okay, pressure injury, so that's called unstageable. So you would know that there's an unstageable pressure injury when you get to see these groups of skin discoloration. You have gray, green, brown, or black eschar. So you would notice that in stage 2, you just have white or yellow eschar. That's also true for stage 3. And for stage 4, you have black or brown eschar. Now, if there's going to be a mixture like black, brown, green, gray, so the green could have been yellow that has progressed into a more intense infection. So this is now something that we could term unstageable. Okay? So pressure injury may develop in bony areas of the body, such as the back of the head, back, the shoulder, the elbow, the buttocks, the hips, the heels, and ankles. But when you're answering question in SATA format related to the parts of the body which are most at risk for the development of pressure injury, please note the patient's position. If the client is lying on his back, then this could be the areas that are at risk. But if the patient could be side lying and the patient's not changing the position properly, then it could be that the back of the head could not be the one that could be at risk, but it could be the area on the ears. Of course, you have the shoulder, specifically here near the acromion process, and then of course the side of not necessarily the buttocks but the hips. Okay, and then the ankles. Okay, so you have to pay particular attention on how the patient is lying on bed before you even decide to put a click on any of those choices in your test. Okay, so this is when the patient's lying on the back. Look, back of the head, you have the shoulders, you have the elbow, you have the buttocks, you have the heels, and of course the hips. Okay, so prevention of pressure injury would include avoiding slipping or sliding on bed because of the shearing force. And this is important, especially when you have elderly clients. And then using powder on the sheets, then losing weight, because tremendous amount of weight could actually put pressure on some parts of the body. And then, of course, avoid massaging the area near the injury, especially if that's already stage 3, you don't massage it. Then avoiding the use of donut shape or ring shaped cushions because it would exert pressure on the surrounding tissues. Okay, so even if you are protecting the area of injury, the surrounding tissues could be hard pressed when you're using a donut shape or ring shaped cushion, especially when you have a wheelchaired patient. Okay, so observing any of the following needs, reporting to the healthcare provider. If you observe foul odor, pus, redness or tenderness, swollen skin, and fever, you have to document this when a patient is endorsed to you, especially with these conditions that are already showing. So in other words, when you have this, as the patient is endorsed to you, make sure you document it properly. Okay, you can even take pictures so that comes with the picture, you have to describe how the skin looks like when the patient was endorsed to you. Okay, so once again, it's shout out time. Congratulations to Chantel Victoria Toralba of Holy Name University in Bohol for passing the Texas Board of Nursing last January 29, 2021. Thank you for the trust and for choosing Ray A. Gapuz review system. So here's your mentor, Ray. And your fact check buddy saying a functional concept today keeps your NCLEX RN fears away. So if you love this video, please don't forget to subscribe and hit the like and bell buttons. So let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. So see you and let's learn together through my YouTube channel. Happy learning. May all your dreams come true. I'm here with you guys, your support. Mentor Ray, your fact check buddy. See you in my next video.